and good evening. I'm Melisa Idris, and you're watching The Future is Female. This is the show where we find the extraordinary in every woman. Breast cancer is the most common form of cancer affecting women in Malaysia. About 1 in 19 of us in this country are at risk. And that's, if you compare that to Europe and the US, where 1 in 8 are at risk. Now, what's even more unfortunate is that 40% of the new cases diagnosed in Malaysia each year were already in the very advanced stages of the disease. So screening and early detection remain a challenge here in the country, and the lack of education and misconceptions about the disease add to these hurdles. So how do you educate a diverse population, ideally without words, about a topic that they may not want to discuss or may be embarrassed to? The way to do that is to use a stand-in for the breast, which can bypass all the communication barriers of literacy, taboo, shame, and fear. And in this case, a dozen lemons in an egg carton. That's exactly what the Know Your Lemon campaign does. A dozen lemons, each bearing a different indicator of the disease, showing women what breast cancer can look like, because lumps are not the only indicator of that something is wrong. So the campaign was adopted by Universiti Malaya's Dr Nur Aisha Taib. She's on a mission to educate every woman in Malaysia about breast cancer symptoms. She joins us on the show now. Dr Nur Aisha Taib, consultant breast surgeon at Universiti Malaya Medical Centre, professor at the Department of Surgery at UM's Faculty of Medicine, and head of UM's Centre Cancer Research Institute. Welcome to this show, Dr. Aisha. It's a pleasure to have you.
Pleasure is all mine, Melisa. Nice to see you and contribute to this very nice session on women as the future.
Yeah. I mean, I think this is great. The Know Your Lemons campaign. I'm really curious to know how you came to discover the campaign and how you came to be a part of it and bring it to Malaysia.
It all happened in Myanmar, in Yangon, in 2017, on a little bus on the way to a little get-together hosted by the host doctors who was actually having a sort of a do with their patient and the breast cancer survivors. So this is the Southeast Asia Breast Cancer Symposium that on that year in 2017 was held in Myanmar, way before COVID. And on that little truck or that little bus on the way there, I got to meet very interesting people. They were actually doctors from the US who were actually very, very keen on improving global health around breast cancer. So on that bus, they were distributing these little cards, and they were showing that they had made some translations into Myanmarese. So I had a look at it and oh my God, this is like amazing because I'm actually a doctor. So I actually did a doctorate on the subject of why women present with advanced breast cancer. So I finished my training in 2001, and for close to about 8 years, I was just doing a lot of clinical work. We wear many hats in TPUM, and I, at those very early years of my surgical career, we were really down, like really in clinical work. And what I saw in my practice was really people in all walks of life, whatever educational background, they came with fungating tumors, huge, massive tumors that could have been detected by themselves, maybe way before, maybe about 6 months for those who have very aggressive cancer, or even up to maybe 10 years if they've had it for, a slow-growing tumor over a long time, a long period of time. So that aha moment on that little bus in Myanmar, I met not Corrine, but her colleague who was there to present about Know Your Lemons. And it was amazing because this way of educating removes the stigma, removes the fact that you can just put it up almost anywhere, even in the surau. And that's what we did with medical students, There was a group of students who wanted to do a campaign, and they do this part of their undergraduate training. And we actually presented it in the kafa, kafa, the evening Islamic school for
Studies.
students.
Mm-hmm.
Yeah, and we put it up, we put up posters in that classroom, and I think it really didn't matter. You could
Mm.
put up those images anywhere. And
Right.
seeing that, yeah, it was just so interesting. And during that doctorate, I came up with this explanatory model why people present with advanced cancer. So it was mainly breast health literacy. It was really people not understanding what were the symptoms and what were the outcomes. People didn't know that cancer could spread and make life difficult and even can cause death. So that was really telling. This was a qualitative study of about 19 women who present with very advanced disease in my hospital. So
All
the
right.
other thing was that they were not sure about treatment outcomes as well. But I think what we see, the issues about around advanced breast cancer is multiple and quite complex. The other thing is the coping skills. Are they able to cope with learning that they may actually have cancer? And the other one, of course, is finances. Finances
Okay.
part is actually a massive part of
Right.
people not coming forward to the hospital sometimes.
So the fear of being saddled with huge, medical bills at the end of the
Yeah,
day. Okay. So that stops someone from from getting an assessment or getting help or getting diagnosed. That's quite interesting, and I want to come back to this the breast
know your
health
lemons.
literacy in Malaysia
Mm,
and know your lemons, because I think it's really it's a wonderful visualization of breast cancer symptoms, because it takes away, as you said, it's just a lemon, but and it has no kind of cultural bearing. It doesn't look like a breast. It doesn't. It removes all the kind of censorship and sexualization that's attached to
exactly.
images of breasts. And can we talk a little bit about that? Because again, it ties in with the breast health literacy, because I think a lot of women don't understand that breast cancer the symptoms can manifest in different ways. I think most of us understand vaguely that, you do a self breast examination, but you're looking for lumps. You're not aware of all the other types of symptoms that can present
Exactly.
as breast cancer.
Yeah, I think the non-lump symptoms are actually an independent factor in why people delay their presentation. So I had a PhD student who did a survey in 6 public hospitals around the country, and that was exactly it, non-lump symptoms. People didn't know that these symptoms could actually be breast cancer. So I remember on that bus in Yangon, looking at those pictures, and I think Corrine has always been open to discussions and adapting. One of the symptoms that was not there was actually an ulcer, like a
Okay.
little break in the skin. So in my patient that I interviewed, there was a lady who didn't know that that sore was actually a cancer. So there are some very slow growing tumors that can, grow very slowly over a period of even 10 years. And people don't know that that is actually a cancer because it's
Mm.
usually painless. But the most common symptom is a painless breast lump. And I think I love the way Corrine had put it into the visualization. It was not just about how things looked, it was also how things felt. So
Mm.
there is
Right.
a image describing how a lump would feel like. Is it a hard, immovable lump? That means it's not moving, it's just static. Um, and is it soft and squishy like the lymph node? So she makes, despite it all being a visualization, a design of how breast cancer symptoms can look like, it also teaches how it feels like. How do you feel whether that lump is something dangerous or not? So this is the thing that we lack, I think, the symptom recognition that is a problem among our community members, but it's also
Mm.
among the healthcare providers. So we did a survey of nurses and doctors who are not specialized in breast cancer, and we found that about 16% of them did not know that a painless breast lump is actually a cancer, could be a cancer. And
Wow.
about 50% of them didn't know that advancing age is a risk factor. So, as you get older, you have a higher risk of getting cancer. So that among nurses and doctors who are not really directly involved in cancer care, they don't really know all these things, you know. So
Wow, so
I
there's
see,
still
yeah, so
so
much
much
things,
education
yeah.
is still needed. I can see that. Dr. Aisha, can you tell me a little bit about how you plan to spread the message of Know Your Lemons to other parts of Malaysia? So I know you mentioned a study within but are there, is there um, something in the
How do
works
we get
for,
this rolled
yeah,
out, right? Yes,
taking
so
this
we are
message
doing
out
a
to the rest
pilot
of the
study.
country?
Yeah, so I think what we should do are studies that can be sort of to build evidence before we roll out to the rest of the country. So at
Okay.
the moment, we know that these materials are good because we have about 940 people who had answered our surveys when they looked at these materials, when we did campaigns around the campus and also around Selangor. So we had one in Puchong, we had one in Klang, and then we had among healthcare providers as it was a Selangor Jabatan Kesihatan Negeri Selangor do on cancer. So we collated about 940 responses, and it really shows that the confidence in detecting on perceived knowledge of detecting a symptom increased by 2 points. So from a mean score of about 2.9, it came up to about 4.3 something. So it can definitely increase the confidence of people. And this is not just people on the street, it's also healthcare providers, right? And
Mm.
so that is what we've done so far. So we found that people liked it. They found it very engaging. They are drawn to it. They're very confident. Increases their confidence in detecting symptoms and also knowing what tests to do next. Because if you
Mm.
notice on the Know Your Lemons materials, they also explain the process of diagnosis, which is something that not many people know. And what happens sometimes when a young person goes to see the GP will feel, oh, this lump, you're very young, you're only 28. This lump doesn't feel very cancerous, it's very mobile, and then doesn't do anything after that. But if the woman is empowered to know that when a lump is found, she needs to go for imaging. That means she needs to go for an ultrasound or a mammogram if she's above 35. And to make a diagnosis, a biopsy has to be made. So these are empowering information that I think not many women know, and unfortunately, even healthcare providers are lacking in. So we are doing a current project called the Rebong. Rebong is reducing barriers in early cancer diagnosis in the urban B40 group. So it's called Rebong. What it does is it focuses on 4 Malaysia top cancers, which is breast, colorectal, lung, as well as cervical cancer. And what we have done with this is that we are actually working in collaboration with Know Your Lemons Foundation with Corrine to use the Know Your Lemons for the breast cancer educational materials, but we are also developing materials for lung cancer, colorectal cancer, as well as cervical cancer. And these
Wonderful.
materials that we are doing is actually a PhD project. So if you talk to Corrine, she did a PhD, on the Know
Yes,
Your Lemons. So it's
that's
amazing.
right. She is.
Exactly.
We're
So
going to be
Rebong
talk.
is like a
Yes.
complex intervention that sort of there are three main things that is produced by Rebong. We'll be working on this for the last 1.5 years, and we will end our study in May next year. So
That's
this study is part
wonderful.
of the Impact interdisciplinary research grant that was given for impactful research. So we are doing three tools, which is one, a strategic communication campaign that is a PhD project, and one is the GT educational module, which is going to be online, and the other one is community navigator training program, which will help educate identified people in the community that can act as community navigators. So these are
That's
the outcomes, the tools that we will be producing with Robo. And this is like a pilot project that we are
right.
doing in Taman Medan, a small little location with the collaboration with Ministry of Health. So this is what Ministry of Health is trying to do. Do small little pilot projects, see whether it works, and if it works, we shall move it to other places.
Oh, well, I'm so excited and encouraged to hear about it. I'll be keeping a close eye to see how this develops. Thank you so much for sharing some of the work that you've been doing, particularly around bringing awareness about breast cancer symptoms and also the diagnostic pathway. Thank you so much, Dr. Aisha, for
Yeah.
joining us on the show. We're going to be taking a quick break now, but after this, we'll come back and speak to the creator of the Know Your Lemons campaign, Dr. Corrine Ellsworth-Beaumont. So stay tuned to The Future is Female. We'll be right back. Hi, welcome back to The Future is Female. I'm Melisa Idris, and I'm delighted to introduce my next guest, Dr. Corrine Ellsworth-Beaumont. She's the founder of the Know Your Lemons Foundation, which is formerly known as Worldwide Breast Cancer. She's the creator of and the designer behind the Know Your Lemons campaign. Welcome, Corrine. It's good of you to join us on the show. I love the Know Your Lemons campaign. I think it is such an elegant way, deceptively simple a way of visualizing breast cancer symptoms. You're looking at the breast in a way that isn't sexual, that isn't gory, that won't be censored. And I'm just wondering if you could tell us a little bit more about the campaign, about how you came up with the Know Your Lemons campaign, and why you're passionate about education for early detection of breast cancer.
Yes. Oh, thank you so much, Melissa. So glad to be here. So the Know Your Lemons campaign, what we do is we use lemons as a substitute for breasts so that we can show in detail symptoms of breast cancer and make it easy to open up conversations about breast health. The reason why I'm so passionate about this is because both of my grandmothers were taken by breast cancer, and a very close friend. And as a designer, I realized that we really don't talk about breast health. It's not something we discuss in school. It's not something we discuss with our friends, really. And as a designer, I thought we can do more to open up this conversation, make it interesting, make it engaging, so that when people see these images, they can be educated, but also engaged in what they're learning and make it really easy to share. So how I came up with this campaign, how did I come up with lemons as something to use for breasts, is that I knew that we needed kind of a metaphor to explain breasts. And so I started off by looking at jugs and cones and melons and all kinds of different euphemisms for breasts. But lemons are friendly. They have skin pores. They have a nipple. And when you cut a lemon from navel to navel, it actually looks a lot like breast anatomy. And a cancerous lump often feels hard and immovable like a lemon seed. So it's a perfect analogy to explain all of these things that you need to know when it comes to breast health. And so what the campaign is we've got 12 lemons inside of an egg carton that show you how breast cancer can look and feel. And knowing those symptoms has saved quite a few women's lives because they were educated and they knew that that change was something that needed to be brought to the attention of a doctor, and they were able to advocate for themselves because they were empowered and informed. And if we can do that with more women, we will save so many lives from breast cancer through education because it's found early. That's the goal.
I have to admit, Corrine, that I learned about the different symptoms. I think I knew peripherally that it was that you look for lumps and a self-examination, that you I kind of understood the diagnostic pathway, but to really see the visual representation of all the different symptoms really taught me that breast cancer can present in so many different ways. So that was, I think, a teaching moment for me as well. Can I ask you about the visual representation of breast cancer symptoms? Why? I mean, there's so much information out there, but it's usually very, medical jargon. There's a lot of text, and I'm sure I've come across information about breast cancer symptoms before, but I don't know why it never stuck the way seeing 12 lemons in an egg carton did to me. What is that? What is that kind of behavioral something in our behavior that we remember images a bit more? As a designer, can you tell me a little bit about why design of visualization is important?
Yeah, that's a great question. You know, if we want to get somewhere, we have the option to look at a map that navigates us, or someone could write out detailed instructions in using text to say, step 1, do this, step 2, do that. But when we see it on a map, it's so clear, oh, this is how I get there, right? And you can kind of understand in an instant, oh, I'm going to start here and it's going to kind of move through town and then I'm going to end up on this side. Um, and there are just some pieces of information that need visuals to go with them for us to understand it. So because it's hard to talk about breasts, because people have a lot of restrictions in showing pictures of breasts, they've been putting everything in text. And we just don't really have the time to read through it. And sometimes how we interpret one word is going to be different to another person and how they interpret that word and what they think it looks like. But when we show a picture, we're saying, this is what you're looking for. And in 60 seconds, we can educate about the 12 signs of breast cancer. But if we wrote out in detail what all of these symptoms looked like, it would take a lot more time. And then you're also making the information not accessible to people who have literacy issues, which is a huge thing around the world. So what we're doing is we're making the campaign more accessible because we're not relying just on descriptions of what this is. We're actually showing what it is so people can understand what they need to look and feel for so that they can find it earlier.
Well, you know, Dr. Aisha earlier in the conversation said they're hanging the images and the pictures, you know, in religious classrooms and in outside mosques. And because they're, you know, and I can't imagine doing that with a picture of an actual breast, you know, you'll get censored and
Right.
it's so closely associated to sex. You'll never be able to hang images of breast cancer up. So I think that's quite fascinating. Is that how did you go from just the image or the idea of 12 lemons in an egg carton to a campaign? I mean, what else needed to be done to get that information out there? What and where are you now? I'm sure, you know, it kind of went viral a few years ago, and now
Yes.
you have an app and you've got like a proper, you know, you've got the material to get the word out there. What has that process been like?
Well, so this started out as my design project as part of my university degree is where all this began.
Amazing.
And then afterwards, I got a PhD in the subject to understand how to do this for international audiences. And then I was a professor in entrepreneurship in London for several years. And then when my close friend died from breast cancer, and she had a couple of the symptoms that were on the poster I designed, and I thought, you know, it's not enough for me to have created this thing. It needs to be out there to people. And in order to spread something, you need to do it through an organization. So that's when I founded the nonprofit. And I used my own savings to start this charity. And then we just started translating it into more languages so more people could see the image. And today we've reached over 1 billion people online with the Know Your Lemons campaign. And women come to us every month saying, because I saw this image, I'm alive. And that's really great. So what we've done to expand the campaign is we have our social media stuff. Anyone can follow us at Know Your Lemons on any of the social media platforms and share our images, because women say to us, someone shared this on Facebook or someone shared this on Instagram. And that's how I knew I had a symptom. And then we also have our Know Your Lemons app. Currently it's in English, but we're going to be expanding it to more languages in the future. But this is a personalized way of understanding what your risk is. We have a risk assessment as part of that, understanding tools for screening. It sends you reminders on how to self-exam. We have Melisa, who is an audio coach, and she will talk you through in detail what each part of the breast feels like, how to do a self-exam.
You mean the Mona Lisa?
The Mona Lisa, I know. It was so hard to work with her agent on this, but we finally got the deal done. So,
She must, yeah, she must be very highly in demand.
Yes.
With the smile.
So that's like a personalized way where you and the app also has a period tracker because breasts change throughout the month. So this helps you kind of keep track of where you are in your breast cycle and the best time to do a self-exam, which is right after your period ends. If you don't menstruate anymore, or if you're a man, the app can adjust for that as well, because men can get breast cancer too. So it's personalized. It makes it so easy. All the information's in one spot, and it's free. And then the next part of our campaign that we've expanded to is we train volunteer educators. We call them Lemonistas, and they teach classes in their community. So this is going to reach people who aren't online, people who don't use apps, and they can talk to them in a really personalized way. Just before this call, I was teaching a Know Your Lemons class to a company with 400 people as part of our Zoom class. So now today, 400 people were educated about their breast health, and it's men and women in the class. And it's just a really fun, engaging way. And so, you know, anyone can volunteer. They can apply at breastschool.org/volunteer, and they can sign up, and we'll train you through an online course and give you teaching tools, and you can go out into your community and make a difference so more people can be educated, have it detected earlier, and save lives. You can join our movement to help us change what breast cancer is like for more people by saving lives.
Thank you so much, Corrine, for not just joining us on the show today, but for all the good work that you're doing. All the best with that. Yeah, thank you for telling us your story. It's been a pleasure talking to you today.
Thank you so much, Melissa. So happy to be here.
That was Corrine Ellsworth Beaumont, CEO and founder of Know Your Lemons. You can get more information at knowyourlemons.com. And that's all we have for you on this episode of The Future's Female. I will be back with you same time next week for another episode. I'm Melissa Idris, and thank you so much for watching. Good night.